Well, and I'm glad you ended on that, because in real terms, what's the impact of what we're looking at going forward, but also what's the impact of what has already been implemented on Americans in general and particularly on communities of color. And I know that's the area that you're going to address for us.
Right. Thank you so much, Tracy. And thanks, Mark, for really laying out the questions that are presented before the Supreme Court. What I want to do today is really expound upon two issues that Mark raised. One is the issue of Medicaid expansion, and which we know is a significant piece of the Affordable Care Act's health insurance reforms. And then second, look at the issue of severability and its impact on the health reform law, really focusing on the health equity related provisions of the law that are aimed at addressing disparities, pervasive disparities among vulnerable populations, racial and ethnic minorities, LGBT individuals, people with disabilities, et cetera. And one of the things that I think gets lost in this discussion is the fact that there are victims of the status quo. And so just want to remind folks that we're dealing with every single year approximately 20,000 people dying because they lack health insurance coverage and do not have access to health services. And that's at the lower end. In fact, another study found that the real number, the actual number, is about 45,000 individuals, which means that by the end of our webcast, 5 individuals will have lost their lives. We all know that the ranks of the uninsured and underinsured continue to rise every single year, and yet, ironically, many of the same governors and attorney generals who are fighting to repeal the health reform law represent states with the highest uninsurance rates. These same states would benefit tremendously from President Obama's efforts to increase access to health services, including the expansion of Medicaid and the creation of the health insurance exchanges. We're seeing how some of these expansions today are really increasing access to Affordable Care Act. And the latest data show that about 2.5 million young adults have gained coverage under the ACA, more than half of which are racial and ethnic minorities. Talk about the civil rights implications of the Supreme Court's decision. Opponents of health reform know that if they successfully repeal the Medicaid expansion provisions under the Affordable Care Act, they would have decimated a critical piece of the Obama administration's efforts to expand coverage. Under the ACA, 32 million individuals, more than half of which would be gaining insurance under the Medicaid expansion, would benefit. And for racial and ethnic minorities, who are the most likely to be uninsured, experience higher unemployment rates, and have lower incomes, making it harder to obtain employer-sponsored health insurance coverage, Medicaid expansion would provide the communities access to health services. Since it was first established by Congress in the 1960s, the Medicaid program is the nation's largest public health insurance program, financing healthcare services for over 60 million low-income individuals and covering 40% of births in the United States. More than 2/3 of Medicaid beneficiaries are low-income families with dependent children. This also includes pregnant women and children under the age of 6 with family incomes below 133% of the federal poverty level, which is a little over $14,000 per individual in 2011. And then the rest of the beneficiaries under Medicaid include older adults and people with disabilities. Now, the ACA expands the Medicaid program by requiring that participating states cover nearly all of adults under the age of 65 with household incomes at or below 133% of the federal poverty level beginning in 2013. So for the first time ever, childless adults and non-pregnant women will be able to secure health insurance coverage under the Medicaid program if they meet these certain criteria. To fund this, as Mark stated earlier, the federal government's covering 100% of the state's expenses, the cost of expanding Medicaid. And then after 2020 and thereafter, they'll be covering it about 90%. Now, what concerns me most is the Supreme Court's review of the Medicaid expansion because, as Mark mentioned, none of the appellate courts were reviewing this. And in fact, when the 11th Circuit Court of Appeals case went to the Supreme Court, they had actually decided that the rest of the provisions, although they found the individual mandate unconstitutional, the rest of the law was left intact. And so that worries me because I wonder, what does this mean in terms of the Supreme Court reviewing this being a major piece of the expansion efforts. Remember, 16 million people will benefit under this program, half of the folks that are expected to be covered and insured. Now, the other point that I wanted to segue into is the fact that, health insurance coverage is critically important. And the Congress and the Obama administration recognized, however, that just having health insurance would not necessarily equate to access to quality health services, treatments, and better outcomes. That's why the ACA included comprehensive reforms to address the fragmentation of health services and the elimination of health disparities among vulnerable populations. When we look at disparities in access to care and in the provision of health services for vulnerable populations, the numbers are quite alarming. Take, for instance, the fact that every year more than 83,000 racial and ethnic minorities die because they don't have access to high-quality health care that is culturally competent. This, of course, is costing our country $1.24 trillion in direct and indirect costs. And this is over a 4-year period. So we're looking at every single year about $60 billion in direct healthcare expenditures that we're spending because we're not addressing these disparities. Interestingly, about 20% of these disparities are attributed to a lack of health insurance, which is why I'm concerned about the other provisions as well, which show that 80% of disparities would be covered through improving quality, addressing the intersection of quality and health services, really increasing our prevention efforts and public health efforts in this country. Should the Supreme Court, however, deem the individual mandate or any other provision unconstitutional, what will this mean for the rest of the provisions that are currently in effect or that are soon to come into effect, like those that would prohibit pre-existing condition exclusions for children, require dependent coverage up to the age of 26, prohibit lifetime caps, prohibit charging women more because they have the ability to get pregnant, or rescinding coverage to women because they are the victims of rape? You know, how about when we look at the provisions that are going to transform the delivery of care from treating sickness to preventing illness and promoting wellness, or ensure that we have a more robust data collection and reporting system in our country that really track the disparities in health status and health care, as well as to help us to develop behavioral interventions and supports for these at-risk communities. And I could go on and on and on about the other provisions. You know, for the first time ever, why I'm so excited is that we have federal legislation that was passed that included robust health equity provisions. If the Supreme Court were to decide that the individual mandate was unconstitutional and not severable from the rest of the law, the entire ACA would be struck down. This means every single provision aimed at eliminating disparities among vulnerable populations would also die with the rest of the ACA. And we would continue to see countless lives lost. We would continue to see millions of people suffer, and an increased cost burden to the United States for failing to address these important issues. Thanks.
Thank you so much.